All right, thank you for staying with us. This is Good Morning Kenya, and we now get into our health check segment. And today's conversation, as I had mentioned earlier on when we were beginning Good Morning Kenya, is on acute gastroenteritis, specifically in children. This is a condition, and we have a doctor on set who will be letting us in on this condition, letting us know what it is all about, how the symptoms look like, who exactly gets affected by this, what particular age, because we're looking at it in children and all of that. The doctor is Dr. Elegwa Lynn Ivy, and she is a medical officer at Katani Hospital. Welcome to the program.
Thank you so much. I appreciate being here.
All right, it's a pleasure having you on set. Let's get into this, because it sounds like a really big word, you know?
Yeah.
It's a mouthful, actually.
Yes.
You know, I had to actually Google the pronunciation, the proper pronunciation of it, you know?
Yes.
So let's get into it. What is the definition? What is gastroenteritis?
Okay, so basically acute, I know gastroenteritis is quite a large term, but to put it in layman's language, it's basically just diarrhea in children. But now the reason why I didn't say acute diarrhea in children, it's because it comes with a multiple of factors. It's not just simply diarrhea. So acute gastroenteritis is basically infection and inflammation of the stomach wall and intestinal wall that leads to diarrhea, stomachache, and vomiting.
Okay.
Yes.
Okay. So that is what it is.
That's what it is.
In simple terms.
In simple
without
terms.
using the big word.
Without using the big
medical,
yes.
medical term.
Yes.
All right. So it's diarrhea, vomiting in children.
Yes.
And what causes it?
Okay, so the causes of acute gastroenteritis are broad, cut across. We have how the kids get it and what actually do the kids get that lead to the diarrhea. So I'll start with how the kids get this. So it's infection that can be transmitted through contaminated food and water. That is the main transmission. Anything contaminated, especially food and water. And what kids get after being contaminated or being exposed to dirty water or dirty food is bacteria. It can be a virus or it can be a protozoa. And how these are broken down, for protozoa, most people know of amoeba. I feel like that's what most people know. Nimekuwa na amoeba, nimepata amoeba, that's protozoa or giardia. And then for viruses, the one that's common in kids is rotavirus. You can have adenovirus, norovirus, but the most common in kids is rotavirus. And then for bacteria, I think this one is also very common. You have cholera, you have dysentery, you have E. coli, you have typhoid. I feel like cholera, typhoid, those are the most common here that people know about.
Yeah.
Yes.
Okay, so those are the causes.
Those are the causes
of this condition.
Of this condition, yes.
Does it have a specific age? Because when you talk about cholera, when you talk about amoeba, when you talk about typhoid, these are conditions that can also affect adults.
Yes.
So is there a specific age to gastroenteritis?
Okay. For gastroenteritis, especially when we're talking for pediatrics, these are conditions that mostly affect kids less than 5 years. And it tends to be rampant in kids who are between 6 years to 2 years. That is where it's most rampant. But any child under 5 years can be able to get this. And we find that in Kenya, it's the #3 leading cause of mortality. After pneumonia and neonatal infections. The neonatal sepsis, the birth asphyxia, diarrhea comes in as #3 leading cause. And in Kenya, you find that in a year, you can lose up to 17,000 children. Yes, just from gastroenteritis. Yeah, so it's a condition that encompasses kids under 5 years, but it's mostly common in children between 6 months to 2 years.
Is it very common? Is it rampant in the country?
Yes, it's a condition that is rampant, especially if you find in endemic areas. You have people staying in the slums, you have people Mombasa region, you have Kisumu region, places where water is easily stagnant, ama people that use the water that passes through the streams or through the rivers. It's very common for them to get this poor disposal, garbage waste. If you don't dispose your garbage waste vizuri, you get it. Poor sanitation, places that don't have, you don't teach your kids that don't touch everything, don't lick everything. Poor sanitation, poor hand hygiene, it's something that is quite common, especially in kids 6 months to 2 years. That's when kids are learning to touch everything.
Yeah, and
that's
everything they touch, they want to put in their mouth.
They want to put in their mouth. You find when kids are teething, a mother will come to you, ako, mtoto wangu meno inatoka anaharisha. So mothers think because kids are teething, they get diarrhea because of teething.
Is that not obvious?
No, it's not. They get teething because teething is very irritable to the gums. It's very inawasha. It's very irritable. That's why you get puppies dying around that time when they're teething. So with small kids, what happens is due to that irritation, they want to soothe it with anything possible. So they pick up stuff and bite, chew on it, nibble on it. And that when that happens, infection. Because it's something contaminated, it's something dirty. When kids are crawling, they're touching everything. They're licking everything. When kids are learning to walk, they want to touch everywhere. Contamination. And that's how they get the infection.
So when a child is teething, because diarrhea kind of, for some people they may think it's part of a symptom or part of
teething.
Part of teething. So it's not part of teething.
It's not part of teething.
Because they are touching things that may be
They're touching things
contaminated.
that are contaminated. They're trying to actually advise mothers. These days, society is very advanced. You can actually, they're teethers. Actually, they're just named teethers. You can get them in any baby shop. So what happens with the teether? You place it in a fridge. You place some fruits in it. Put a mango, put a watermelon, place it in the fridge, let it cool a bit. And then when you notice your child is trying to touch everything, your child is trying to nibble on the socks, they're trying to nibble on their toys, give them that instead. And ensure that it's very well cleaned. Warm water. You even find younger kids less than 6 months, because of breastfeeding, mothers are pumping, they are using bottles. So when you use bottles, you're using teethers, you don't clean them properly. After a child has used that bottle, you leave it there, it's open, germs, insects, and afterwards the house help comes, warms it a bit, gives it back to the child. You're already contaminating. Yes, so it's hygiene, especially when it comes to kids, it all just revolves around hygiene, ensuring that everything that goes in the mouth is clean. Before you handle your kid, wash your hands. If you're from work, you're coming to breastfeed your baby, ensure that your hands are clean. Yes.
All right. So would you say that gastroenteritis is equal to food poisoning, or is there a difference between that and food poisoning?
Oh, there is a difference between gastroenteritis and food poisoning. And food poisoning, we mostly find it in adults, but you can also find it in kids, yes, especially school-going kids that are boring each other food. That is quite different. Gastroenteritis is actively caused by an infection, while food poisoning, it's the food. It's the food that you take. There is something in the food that actually triggers the diarrhea. And of this, with food poisoning, some tend to be self-limiting, but with gastroenteritis, especially in kids, it's something that actively has to be managed. With food poisoning, it can be food has stayed in the fridge for quite a while. There is bacteria overproduced. With food poisoning is you go, you eat at a kibanda somewhere, the maragwe didn't sit well with your stomach, you get it. But gastroenteritis, it's specifically from contamination. That one, it's specifically from bacterial, viral, protozoal contamination. Yes.
Got it. So is it contagious?
Yes, it is contagious. Gastroenteritis is contagious because it's fecal oral, anything uchafu. So if you're having your kids in daycare, if you're having your kids who are going to PP1s, if you're having your kids in school, if some kid is diarrheaing when they go to the toilet after they're finished their business, they're tying their shoe, they come give you a banana, those hands are dirty. The way they're sharing that banana, the other kid will get an infection. And given that it's a viral, especially let's say in a homestead, one person gets, it's like flu. Gastroenteritis is like flu, the virus. One person gets it, it can easily spread, especially if your sanitation around the area is dirty, it can easily spread. That's why when you have one person with cholera, you get a cholera outbreak and it becomes an epidemic. So it is something that is quite contagious, yes.
Yeah. So say maybe one child has gotten it in the home. What can the parent or the guardian in that home do to ensure that it does not spread, you know, maybe to the rest of the children and even the adults as well?
Okay. So the first thing that I'll start, it all boils down to sanitation. The first thing that starts as a mom when you realize one of your kid has, the first thing, you start it from the home, and then there is also the hospital basis. So when you start from the home basis, how are you cleaning your foods? Where are you getting your food supply? Where are you getting your water supply? You know, this thing can also be through water. And I've noticed this especially at hospital, Katani Hospital. Like in a week I can see, especially like you see a lot of people coming in with stomach aches, diarrhea, vomiting. And you learn what is the main cause, the water system. They are all drinking tap water. And these days actually water has become like more economized. You can buy the refined purified water, 200 bob, 250, 300 for like the 200 liter, or 10 liter for 100 or 150. So get that instead of using tap water, because tap water is basically just sewage water that has been purified, passed through a system into your tap. You shower with it, you wash with it, and you drink it, so you get it. So as a mom, learn what is the one factor that you have in common in the home. Is it all of them are drinking the water? How are you cleaning your foods? These days there is actually soap for cleaning your fruits, for cleaning your vegetables. You just don't go run them underwater. Ensure that you wash them with soap. very well, clean. Ensure that your food is well cooked. You have fish giving you salmonella if it's not well prepared, if it's not well cooked. Teach your kids basic hand hygiene. I know they are small, but teach them basic hand hygiene. You sit there in the hospital, a kid is coming, she's licking everything. She's walking everywhere, licking your stethoscope, licking the desk. That is poor hand hygiene. Start training them as early as possible that what I don't tell you to touch, don't touch. Learn to clean. After a child has gone to the washroom, teach them how to clean their hands. Ensure that you're disposing your waste vizuri, especially in Nairobi. You saw your waste hapo kwa balcony ama hapo in the kitchen. Those fruit flies, they're running all over the dirty stuff, they're coming, they're touching your food. Proper waste disposal. So it starts from the home before it even goes. And immediately you notice one kid has it, ensure that this kid gets management. Ensure that this kid is treated. Yes, you can manage it at home, but if you don't know the right remedies of how to do it, because if you manage it at home and it takes longer, the chances of you exposing your other kids to it are high. So what happens if you notice that one kid already has an issue, ensure that you have them handled, have them taken care of, have them treated. Yes.
All right, so let's get to the signs and symptoms. They're the obvious ones. We've already talked about it. Diarrheaing, vomiting. Are there other symptoms that, you know, maybe a parent can look out for?
Yes, there are other symptoms. Other than the diarrhea and vomiting, you have fever, especially depending on the intensity of the infection. You have fever. You have, the child becomes very irritable. They're just crying. They're just crying. You're like, mbona mtoto analia? Their diapers are clean, they are well fed, they are washed, but they're just crying. That is another symptom. Other times the child is just lethargic, quite weak. They're just weak. Your child used to be playful, running around, jumping there to feet everywhere. This child is just dull. There is decreased appetite. The kid doesn't want to eat because now whatever is going in is coming out. The stomach is hurting. Sometimes it's even bloated because now food is not getting digested properly during this period. They are vomiting, so they just don't want to eat. Or their appetite goes low. So it's either the appetite is reduced or they completely refuse to eat. And then you have mothers telling you that the eyes, like, you know, normal eyes are supposed to be out of your socket. But you find that this mother is complaining that eyes are way deep inside the eyes. So those are some of the things that you actively watch out for. Yes.
Yeah. And you know, with younger children, the toddlers, most of them you wouldn't know what is wrong with them because they can't articulate themselves. They can't mention that, mom, naumwa na tumbo ama nasikia hivi ama vile. Since you mentioned that this is a condition that can get a kid from as young as 6 months, I believe after they're done with purely breastfeeding, now you start weaning them. This is when this can happen. So for a mother who has this toddler who's just 6 months, and they're really not sure, this child is just crying, you know, all through, you know, what would be your advice to them? You know, I'm asking this mainly because sometimes you just try and find remedies in the house, you know, because you don't really know what's up with this child. And maybe, and okay, this is a two-part question. So there's that, right? And then there's also the question of, when it comes to the symptoms, can the child have this condition, but they're not diarrheaing, they're not vomiting, but they have this other, you know, symptoms?
Okay. So you've asked two questions. I'll start with the first one. When it comes to younger kids, it's true, mothers can't figure out. But anytime you notice that your child is more irritable than they're supposed to, ama they're more lethargic, they're weak, they're unresponsive, they're quite dull. Anytime you notice those two things and you can't figure out what's going on, please take that kid to the hospital. It could even be something totally unrelated to gastroenteritis. Because when kids get sick, it's either they cry too much, trying to show that they're uncomfortable, something is not sitting well, or they become extremely weak. They become extremely weak, they're not feeding, they're just dull. If you notice any of these two, go get your kid checked. And when it comes to gastroenteritis, it's uncommon for it to occur without the vomiting and the diarrhea. Yes, because from the term itself, gastroenteritis, you just derive diarrhea from it. So it's very, very uncommon for it to occur without the child diarrheaing, especially diarrheaing. You can have a child not vomiting, they feel like vomiting, but they're not vomiting. But definitely diarrhea has to be part of the symptom. It is the number one symptom. Yes.
When is the diarrheaing and the vomiting considered too much?
Okay. In medical terms, we actually term diarrhea as passing more than 4 or 5 episodes of stool. Like unaharisha like almost 4 times in a day.
Okay.
Yes. And for kids, when it comes to diarrhea, it can even be more than that, because you keep, and then for mothers, we ask them, how many times have you changed the diaper? If you notice, and then, you know, as a mom, you'll notice your child's bowel pattern. You know that ikifika this time round, that's the time the nanny changes the diaper. After feeding, before feeding, at noon, you can notice the timings of how often do you change the diaper, and you can notice how, because kids' stool is still loose. It's not watery loose, but it's still loose. But you can't be able to notice a difference. So that's why we tell mothers to be very, because all this comes down to the mother. Be very, very keen with your kid. And kids are different. So ensure with each kid that you're having, you're very keen to notice the bowel patterns. You used to change their diapers 3 times a day or 2 times a day, but now it's much more frequent. You're giving them food they're not feeding. Anytime you touch their tiny little belly, it's like the child winces or cries or tries to like show that something is off. Yes, that is. And vomiting, it like normally a child is not supposed to vomit. When you feed a child will burp. A child will not vomit. When you start noticing that your kid is vomiting, even if they're not diarrheaing or having any other symptom, but you're noticing you feed your child, they vomit. You feed your child, they vomit. There is something wrong. It could be your technique. It could be you're not burping that kid so they're taking in too much gas. It could be there is something else going on, even if it's just vomit, because a child normally is not supposed to vomit. They burp, but they don't vomit. Those are very different.
All right.
Yes.
Got you on that. Now, is the condition seasonal? Would you say there is a particular time that that it spikes?
Okay.
That you get more patients coming in for that?
Okay. No, gastroenteritis is not seasonal unless we are talking of endemic areas that are more prone, and areas that are more rural areas, disposable waste areas, dirty areas, congested areas, but it's not a seasonal condition. What happens with gastroenteritis, it tends to certain periods in a child developmental stage. So it's not seasonal, like we can say March, April there is diarrhea, no? But it occurs during certain periods in a child development. Like I've said, 6 months. You can have it even before 6 months, and before 6 months it will occur because this child's immunity is not strong enough. Their gut is still adjusting to getting breast milk. Maybe you're using, I've said, you're using bottles to feed this child, you're not cleaning them properly. Now that can be before 6 months, but mostly it's common between 6 months to 2 years, because the developmental stage milestones. When the child is teething, you'll tend to have more kids coming in with diarrhea. When the children are crawling at around 8 months to 9 months, you tend to have this. When the child starts learning to walk, 11, 12 months to even more than 12 months, you tend to have kids coming in with this condition. So I won't strictly say that it has a specific season, like the way we do have flu seasons, no? But during children's developmental or milestone stages, you do have certain times when they come in more prone to diarrhea, to gastroenteritis, yes.
Is it life-threatening?
Yes, yes, gastroenteritis is life-threatening. It is life-threatening. That's why we have it at number 3, causing mortality, and that's why there is actually vaccination. Kids get vaccinated between 6 weeks to 10 weeks for rotavirus vaccine. So it is life-threatening. And why am I saying it's life-threatening? Because especially for younger kids, less than 6 months, diarrhea is subcategorized into 3. You can have a kid coming in shock. This is a child when they have diarrhea, they have vomited to the extent they're unconscious. Their pulses are weak. If you feel on them, the extremities, they're very cold, the eyes are deep, their skin is dry. So they come in at that level, shock, whereby there is decreased blood flow into the system. And why is that? Because infants, 75 to 80% of their body is made up of water. And when you come to children, 65 to 70% is made up of water. For adults, it's 60%. So if you have a child whose body mass is 75 to 80% water, and they're vomiting and they're rearing, meaning they're losing all that water, what is left in the body? So you have a child coming in shock. And when kids come in shock, it actually becomes a pediatric emergency. This is a child who has to be actively managed with a 1-to-1 nurse ratio, doctor monitoring every minute, every second. You have to place 2 to even 3 lines to actively rehydrate, because you have these kids dying. If you don't actively manage it within the first few hours, you have this kid succumbing. And why do they die? Because of the dehydration. They're just losing so much fluids. And basically kids, all their body is made up of fluids. All they're drinking is breast milk. You can't say they won't drink breast milk if they drink something else. They're just breastfeeding. So it is life-threatening. And then after shock, you have severe dehydration. Severe dehydration is whereby the pulse is weak, this child is not feeding, they're extremely, they're responsive, but at a very weak rate. And for such kids, you have to actively have them on IV medications, you have to actively restart their system. So it is life-threatening, something that mothers shouldn't take lightly, because you have mothers buying their time, tota anaharisha, you try your herbal medicine, you try something, you try. No, if you get to the point and you are seeing your child is worsening, the situation is worsening, the situation is worsening, they are vomiting more than they are feeding, they're rearing, you even notice, you look at the pamper, you're not noticing urine. This child, there is nothing left in the system. So everything little that they have, they're what? They're losing. And they're mostly losing salts, they're losing electrolytes, they're losing sugars. And that's what makes up your system's metabolism. So it is life-threatening. Yes.
All right. You know, I want to still stay on the point of dehydration. Can a parent tell that my child is dehydrated? I know that you've mentioned a couple of, you know, maybe symptoms to know that this child is actually dehydrated. Is there more to it?
Yes, yes, a parent can tell, but this is more with older children than with younger children. When a child is excessively thirsty, they just keep asking for water over and over and over. You notice that their skin is quite dry or sluggish. You try pull it, or when you're applying oil, you notice that you pull and it takes longer for it to go back. And this is different. Dry skin for diarrhea is different from dry skin for eczema, because I do know kids get eczema, but this one, it's like you can notice the whole body looks dryish, whitish. If you notice the urine, you're changing diapers, you're not seeing any urine on the diaper. Yes, there is no stool, or maybe you changed two diapers before that was full of stool, loose stool, watery stool. This time around you're changing, you're not noticing any urine. You keep changing, you're not noticing any urine. Another thing that you do is the mouth is dry, cracked around, they are crying, but there are no tears coming out. The eyes are deep within the socket. There is this fontanelle here that is in kids before their bones actively fuse. If it's supposed to be flat, but if you touch it and you feel like it's a bit deeper than it normally is, because when mothers wash kids, they notice it. Most mothers are like, naogopa, naona kama moyo yake inagongea hapo hapana, it's just bones haven't fused yet. So if you touch that and you feel like it's a bit deeper sunken than it should be, that child is quite dehydrated. And then to make matters worse, they're not feeding. Or if they're feeding, it's a very minimal quantity. Or if they're breastfeeding, it's very minimal. They breastfeed after 2 seconds, they're tired, they're too hot, feverish, sweating. That child is dehydrated, and you need to get something done about that. Yes.
All right. So we'll get into the treatment options for that, and even maybe the first step to take when you realize your child has this in the house before you take them to hospital, if there's any remedy. Since umesema tuachane na mambo ya miti shamba.
Yes.
But we'll get into that. But I want to get back to the point where you mentioned that this is the third leading cause of death in children. And you know, just from you explaining or giving us information about what this condition is, I can tell that it's something that is easily treatable. It's something that you can easily prevent. So why do we have it as the third leading cause of death in children?
Okay, so many factors involved. Number one is parents don't take it as seriously as it should be. When they see their kid diarrheaing, they just think, ni kuharisha, so they take it lightly. It's just diarrhea episode. You try, treat it at home, you try, do everything. By the time you're bringing your kid to hospital, it's actually a bit too late. Number two, the herbal. They have said, you go into your herbal medications, it worsens the situation. By the time you're breathing, the child is worse than how they were. Number three, because of how easy it is to get infected. Like, it's something with food and water, and you can't live without food and water. So given that it's food and water, something that you have to intake and something that you get exposed to daily, it makes it very easy to contract. You know, malaria you can prevent. You can sleep under a net, but you can't prevent yourself from feeding. You can't prevent yourself from drinking water. You're walking with your kid, she wants a mango, it gets washed with the mango guy with that dirty water, your kid starts eating it there, and then that's something that's unpreventable. And you know, for you as a big person, your stomach can be able to handle those bacteria, those dirty bacteria. You have your HCl, you also have like a bit of knowledge. But now for this kid, by the time they're coming to tell you something is wrong with my stomach, it's a bit too late. Yes, and you as a mom, and then you also have knowledge. you find that most mothers, by the time this is happening, they're first-time mothers. They have not been exposed to this before. They don't know how this happens. They are at home with their shosho or their mom, and their mom is like, twende tafute mitishamba, mkunyishe hii. Yes. Pea mwarubaini. Ana mix mwarubaini anagonga. And you don't know already this is an intestine that is weak. Because what happens with the bacteria, it goes and attaches on the walls of the stomach, on the walls of the intestines. So once it attaches, it's like it's chewing up on the walls of your stomach. So when you're giving mwarubaini is acidic. Mwarubaini, that thing is very bitter. I don't even know how kids are able to, it's so bitter. And yes, so you're giving that to a stomach that's already like damaged. So you're just burning up and worsening something that's already bad. Yes, so that's why you get it being among the top 3, because most people don't know that this is something that can get so intense. By the time they're realizing it's something that can get so intense, the damage has been done. Another thing, like I said, endemic areas. You stay in Kibera. Sewage inapitia hapo mbele ya mlango yako. That's where you throw your diapers. That's where you throw your pampers. Inapita. I went for community service in Kibera. Wait. You jump sewage to go to the house. Like you are in this house, there is sewage right here, and there is another, and there is... It's just passing right in front of the houses, and that's where they're washing their utensils from. Anaosha hapo mbele, akimwaga hiyo maji kwa sewage. So what are the chances of that kid growing up in that area getting it? And then another thing most people don't learn about these bacteria, especially when it comes to amoeba, typhoid, giardia. This is something, once you get exposed to, it's easier for you to get reinfected despite being treated. It's like a giant that will treat, it will cure, or it goes sleep, and then immediately you take something that is dirty or bad, it goes and recurs and awakens it. And then for kids, like I've said, kids, their immunity is very weak. They're still young, they're still tiny, their body is still trying to figure out, do I like this, do I not like this, does this sit well with me? Yes, by the time this kid is coming to that level, they're getting infected over and over. Your child has had diarrhea almost 3 to 4 times in a year. Chances of them getting it, because their gut is also still weak, is very high. Yes, and then this thing that mothers do when it comes to breastfeeding, exclusively breastfeed for 6 months. There is a reason why it's exclusive for 6 months. There is a reason why they didn't say when mtoto akisikia njaa at 5 months give food. It's strictly for 6 months, because all they're eating is you. So if your nutrition is not proper, the child's nutrition is not proper. And your breast milk contains everything to fight infection in this baby. So that thing of trying to wean early or giving none, unless you've been actively advised to give none, don't go for that option, because you're just predisposing your child's gut to conditions that they later affect them and you don't even know about it. Yes.
All right. Okay, so a child has already gotten it or is infected, has gastroenteritis. What's the first step the mother or the parent or guardian who's in charge of this child should take? What step do I take immediately? You know, after I notice all the symptoms that you've gotten to talk about, including dehydration and all of that, what should be my first step?
Okay. First step depends with timing. You can notice these things saa 6 usiku. You're uko ndani, you can't be able to get a vehicle to get you to town. The first thing you do at that point, breastfeed. Try, as I know they don't want to, they are refusing, but try even that little it will go a long way. Because we're just trying to prevent this child being dry without anything, and they are losing. Because what causes death is the dehydration, the loss of water, the loss of fluids, the loss of electrolytes. That's what causes the death, not the diarrhea itself, what they are losing. So try breastfeed, try get something in this child. The second thing that you can do is clean water. Boil some water. Children don't drink cold water. Boil some water, let it cool, settle at room temperature, sieve it vizuri, give it to this child, and ensure the bottle that you're using is clean. These days there are these containers that can, I want to say pasteurize, but I feel like that's the wrong term. Like they can sanitize, like you can
like
put,
you can sterilize it.
Thank you, that's the word I'm looking for. You can sterilize. There are containers for sterilizing bottles. Put your container in there, have it sterilized. If you're in an environment that you can't buy that, boil them. Warm water, soak your containers in there, wash it vizuri, squeeze it. There are even some tablets that you actively use to wash those containers. You don't use soap. You soak it with that tablet, have it clean, and then wash. Because milk tends to coat Even when you make tea, if you don't wash that sufuria vizuri, you'll find that the milk has coated around that.
Yes, it does.
This, yes. So ensure that it's clean as possible. Put them somewhere nice to dry. Let them dry completely. Have your clean water, let this child drink. If you're next to a chemist, if you can access a chemist, get ORS, oral rehydration solution. Let them drink that as much as possible because that's what's going to help this child.
Why is it important, the ORS?
Okay, ORS is important because of what it contains. ORS contains salts, the nice salts, the sodium, the potassium, the phosphorus. It contains sugars, it contains, and then, you know, it comes as a sachet, powder. So that's what's in the powder. And then you have to dilute it with water. So the water helps all these things get down. Number one, you're making the child drink water because they need that, they're losing. Number two, when you're diarrheaing, you're vomiting, you're not feeding, your blood glucose goes low because there is nothing your body is working with. It has depleted its store, so you start having low glucose. So you have sugar in that. Your salts, your sodium, your potassium, why are these important? This is what helps your cells function. How your cells work, the metabolism of your body, how things move in and out of your cell is sodium, potassium. That's what helps. So that's why we keep insisting on giving ORS. All the three components actively help for rehydration purposes. So if you can be able to get that, get. Although we don't advise for mothers to treat this at home, because for the ORS you have to calculate it depending on the level at which the child comes in. Because I told you the child can come in shock where they're completely unresponsive. You have to actively administer fluids. You bolus fluids for them. You have to check their sugars. They come in with the sugars being extremely low. You have to give dextrose. You have to actively resuscitate. It's like you're resuscitating a child, bringing them back. They can come with severe dehydration. With this, you need to know at what level do they have the severe dehydration so that you can calculate how much ORS they do what they need and for how long. Because it also goes with the age. So that's why we don't advise mothers to do this at home.
Over the counter.
Yes. Because you can just go buy, mix it at a kunyesha uko like, daktari, nilipeana ORS, nilipeana maziwa kufanya. Did you give in conjunction with the level at which your child was dehydrated? Because after severe dehydration, you have some dehydration. This child is able to feed, but they're still diarrheaing. That one also comes with its amount of ORS you're supposed to give, and you calculate it with the kgs, and you have the time frame in which this is supposed to be administered. So most mothers just give, and then they wait, and they're like, it's going to get better, but they don't know, maybe they underdosed or they over, and most of the time it's under. So you find your child is not improving. You did this at home, and nothing is getting better. But for first aid, that, and then it comes to your food. Ensure that everything these kids are eating is well cleaned. Kama analilia maembe kwa barabara, buy it, clean it yourself. Wash it vizuri, get a dish, the sponges for washing your dishes. Wash your maembe vizuri, rinse it, ensure that it's clean. Yes, during this time, blend for them, have them drink light foods. Let them drink porridge, let them blend for them those nice rice. Mix it with vizuri, with greens. Don't just give plain rice, plain ugali. Please, your kids need nutrients. Give everything, like let them have a balanced diet. Yes, because that also helps the nutrition and the healing. And another important thing is zinc. So you'll find most mothers giving something that is less than what is needed. Yes, but that's what they can do firsthand at home.
All right, so that's the immediate, like, first step, first aid for that. So treatment options as we finalize now.
Okay, so for treatment options, it's still the same thing, but now for hospital setup, it's much more advanced. You'll have your ORS. As I've said, that one is important, that one is needed. But now hospital setup, we'll calculate it, we'll give it within a few hours, we'll monitor, and then we have to reassess so that we know where your child lies. The second option is fluids. You have to give fluids. The third option is you have to check their sugars. If their sugars is low, you have to substitute for that. Another option that comes in, zinc. I'd also touched based on that. Zinc is very necessary. And why is zinc necessary? Because zinc helps the immunity. It will help boost immunity in this child. Zinc will help with the healing of the gut, because like I had explained earlier, it's like they go and attach on the walls. And so it's like leaving wounds on the walls of the stomach. So what zinc does, it allows actively for the healing of that gut. And zinc also reduces the days in which the child will diarrhea. Number 3, ensure that your kids get immunized, because rotavirus is the main cause. Yes, rotavirus is the main cause. So ensure that your kids get immunized at 6 weeks, at 10 weeks. Ensure that your kids have been immunized for this. Yes, and then yes.
You were to say something?
Yes, and then when it comes to testing, for gastroenteritis in kids, we don't mostly test, because once you test the stool, most of the time you'll find that like the stool won't capture anything, but it is advisable, especially for older kids who are more than 2 years, because I've said this is a condition that causes mortality in kids less than 5 years. Yes, so kids more than 2 years to 5 years, check their stool. You can find that it can be something else causing. You can find it can be amoeba, it can be giardia, it can be cholera, maybe they're from a cholera endemic zone, and then also know where this patient's from. So if you know where the patient is from, you can also be able to educate them about it. Yes, so if you test, you find whichever bacteria is, then you can give a specific antibiotic depending on the specific bacteria that is affecting the kid.
Okay.
Yes.
All right, we need to finalize the conversation. Maybe is there a mistake that you feel parents keep making over and over?
Okay, I think two mistakes. Number one is lack of knowledge. Most moms, especially for first moms, and depending on the areas where they're from, they don't take it as seriously as it needs to. And then the thing, mitishamba, please, I've seen so many kids die because of this mitishamba issue. Stop trying to treat something that you actively don't understand. These days we have SHA. Have your kid registered under SHA, have them let someone who is a bit more equipped with the knowledge to that tell you what is going on. Yes, so I feel like that's the first mistake, lack of knowledge and trying to self-medicate with things that are not appropriate. And the next thing is hygiene. I know moms, after having kids, you're tired, you're exhausted, you're trying to juggle a newborn, the crying, the sleeping hours, learning to change diapers, but try make it as sanitary as possible. Even if you're alone, try at least the foods you're eating, try at least the bottles you're using for this child that are as clean as possible, and wean until your 6 months are up. If you don't have breast milk, talk to someone, go see a doctor, be put on supplements that can help you increase milk production. There's actually medications that do help increase milk production. There is natural, drink bone soup, eat bananas, both the sweet and the cooked bananas, eat a lot of vegetables, nutrients, have a balance there. Don't just sit on carbs, chapati, mchele, a balanced diet, because that milks your milk. And when you have milk, the child can exclusively breastfeed. Don't try wean before time is up, because you're introducing this kid to infections that they'll have to deal with. Necrotizing enterocolitis, you're introducing them to lactose intolerance. So now they'll start having gut problems, colic. Like, try just breastfeed for the first 6 months as much as possible before you wean. And in case of anything you don't understand about your kid, or you see that your kid is not presenting the way they should be, you can notice, take the child to hospital. Don't sit on it until it gets too late.
Yeah, bottom line, just take them to
hospital.
Just take them
to hospital. It's something that can be treated.
Okay.
Yes.
Thank you so very much
for
sharing your knowledge on this conversation. It was a pleasure having you.
I really appreciate that.
Okay, this is where we end this conversation. That was Dr. Ivy Legua, and we were talking about gastroenteritis. I'm sure that you have been enlightened, and this is where I get to say goodbye.